Hi there, Eric Bakker, the naturopath from New Zealand. Thanks for tuning in. I've got a question here, or not a question, I think a nice comment from a lady called Irene Hertoch. Irene Hertoch. So Irene's saying, thanks a lot for your uploads. I was suffering from candida for a long time. I followed a very strict candida cleanse for so many times, but every time my candida came back. When I read your book, it was an eye-opener. I was allowed to eat some fruits and have a cup of coffee every day, as well as eating gluten-free grains. It made the diet so much easier and sustainable in the long term. Besides that, the stress of eating bad foods like green apples and berries was gone. On top of my candida diet, I did a stool test and it turned out the levels of good bacteria in my intestine were very low. So I worked on that. It looks like now I'm a completely different person. No more depression, no more irritable bowel syndrome, no more headaches, no more tiredness. Thank you so much. This is a fantastic comment here because it illustrates what I'm always trying to tell you folks out there. It's not always an overgrowth of candida or bad bacteria or parasite that's the issue. It's a lack of beneficial bacteria, right? So you can always look at something from a negative point or a positive point. You can look at a glass of wine and say, oh, it's half empty. And then if someone says, yeah, but there's a half a glass still you can drink, okay? So that's the positive. But you're looking at the negative space. So you could be looking at yourself and thinking, I've got candida, which is the half empty glass. All right? But the half full glass could be you've got a huge amount of good bacteria there. Or conversely, okay, it could be quite tricky. You could have a lot less bacteria and have candida plus bad bacteria, okay, and no beneficial bacteria. In that case, your glass is completely empty and you're buggered up, aren't you? So what does this say? Well, like Irene says here, do the stool test. Try and understand what's going on. Go to your naturopath, go to your functional medicine doctor, ask for a stool test. Make sure it's performed properly so that you observe the withholding period for probiotics and antimicrobials. And if you do the test properly, you're going to get a result back that you can act on and get an outcome, just like Irene. Because Irene made the intelligent decision to test. And then she says here, I was suffering from candida for such a long time. And after she did the stool test and she worked on the low level of beneficial bacteria, it all worked out for her. So what does it tell you? It tells you to do the test and try and understand what's going on before you make a decision on which way you should go. Because you may be dealing with things that you're not really sure of. You may watch the YouTube video talking all about candida, but you could be, working it from the wrong angle. And sometimes we can, for years and years, treat something, and yet the treatment wasn't really good. It didn't give us an outcome because we didn't understand exactly what we were dealing with. So, I hope that gives you guys a bit of information out there. So, thank you so much, Irene, for posting this and for showing people that it pays good sometimes to analyze things before you make decisions. Thank you.